My name is Erin Montgomery, and today I'm going to show you how I would assess a newborn. So first, if I'm going to give medication, I'm going to follow my general principles and safety practices, my 3 checks, and my 11 rights. I have already done my hand hygiene and put my gloves on. So now I am going to get this. I'm putting the baby on its side. Putting that there. And then I am vigorously drying off the baby to stimulate crying. Getting the legs. Okay. And then I'm going to remove the wet linen, put in a clean blanket. And now this is going to be my scale. Okay. So the baby is under a warming light. So now I'm going to auscultate the heart rate for a minute. And while I did that, I was assessing the lung sounds. The lung sounded good. The baby is crying a nice loud cry, so that is good. The coloring is a nice pink. And then she is contracted up like she should be. The muscle tone is good, and she has good reflexes in her foot. So now I'm going to assess the cord. There is no bleeding. There is 2 arteries and a vein. And then I'm going to get the vitals. So first, I'm going to get the temperature. If I can find the thingy. We're going to say this is my thermometer. I put it in the armpit until it gave me a reading. So that looked good. Like I said, I've already assessed the respiratory rate and the heart rate, and it was good. I would use my blood pressure cuff, an appropriate sized one, and take the blood pressure after the baby was 24 hours old. I would take my brachial pulses at the same time. That is good, it's regular and even. And the femoral, that's good. And then I'm going to sit the baby up. And then I'm going to check for the lanugo. There is sparse patches on the shoulder and the back, so that's good. I'm checking for molding on the head and cephalohematoma, and there isn't anything abnormal. I'm going to check for the anterior and the posterior fontanelles. And then I'm going to check the baby's back, supporting the head. Everything looks good, the butt looks good. The extremities are all there like they should be. They have 10 toes and 10 fingers, so that is all normal. And then I'm going to assess my reflexes. So I'm going to have her hold my finger. That was good. Squeeze on with her toes. That was good. And then I'm going to see if she's rooting, and she is. And she put her arms out and squeezed them back in, so that's good. And now I am going to make sure the baby has an armband on, or an ankle bracelet on that matches the mother's. So now I'm going to get the measuring tape out. I'm going to measure the baby from the top of the head. And like I said, everything looked normal on the baby. There is no dark spots anywhere, or no random hair growth anywhere. So from the top of the head down to the heel. And that was good. And I'm going to get her head size on the eyebrows. And that's good. And then on top of the nipples. And that's good. And then I'm going to get the baby. I'm going to zero out the scale. And then put the baby on the scale. Keeping my hand on top so she doesn't roll off. And then gives me my reading. Put her back. I'm going to go ahead and put on her diaper. here for swaddling. I'm gonna go ahead and get that ready. So now I'm going to get the medications. And like I said, I've already done my 3 checks and my 11 rights. So I'm going to clean that one eye, discard, clean that eye, discard, going from the inside out. And then the same with the eyes. And then I will dispose of that according to policy. And now I'm going to get my vitamin D injection. I've already done my 3 checks and 11 rights for this too. So I'm going to clean the leg. Open this using the OK method. Pull it off. And then, that's gonna hurt. Hold the leg, inject. And then in the same motion, I'm going to pop the safety. And then dispose that in the sharps. So now, the only thing I have left to do is swaddle the baby. And then I would give the baby to the mom, and after that I would take off my gloves, hand hygiene, record and report.